Welcome to Session 6 of the Diabetic Foot Manual. Meet Pedro, 56 years old, living with diabetes for 12 years. Pedro uses insulin but skips doses, only visits the hospital to pick up medication, and has had a wound on the sole of his foot for a month that now smells. Here's the simple rule that anchors this whole session. Below the ankle, treat it as diabetic foot. Any wound below the ankle in a person with diabetes counts, no matter how small, how painless, or how minor it looks. The manual reinforces this on the very next page. Every wound below the ankle in a patient with diabetes mellitus is diabetic foot. So why the strict rule? Because a small wound can hide major damage. What you see is a small cut or sore, often with no pain at all. It looks completely minor. What may hide underneath is deep damage, infection tunneling down toward the bone. Without urgent care, the infection spreads, tissue dies, and amputation looms. Pedro waited a month, and the smell means it's already serious. So what must Pedro do, and what must he never do? You must go urgently to your nearest health center, regardless of the size or appearance of the wound. You must not cover or try to heal it with plants, leaves, sugar, honey, toothpaste, oils, or iodine. Home remedies delay care and mask infection. If the wound is caught early and hospitalization isn't needed, what care should you take at home? See a nutritionist for your diet, follow your doctor's medication instructions strictly, and if insulin was prescribed, use it exactly as directed. Stop smoking and drinking alcohol. Smoking sharply increases your risk of amputation, and ask your doctor about an offloading shoe that takes pressure off the wound while it heals. Here are Pedro's 4 key lessons that save feet. 1. Any wound below the ankle counts. No exceptions, no wait and see, go to a health center the same day. 2. Small wounds hide big damage. Even bone can be affected, and no pain does not mean the wound is minor. 3. Never use home remedies. No sugar, honey, plants, toothpaste, oils, or iodine, because they delay care and worsen infection. And 4. Stop smoking and take your medication. Missing insulin lets infection spread unchecked. This session's content comes from Alianza para el Salvataje del Pie Diabético in Peru, brought to you by Pingu, your AI health companion. Coming up next in Session 7, caring for your wound at home, step by step, how to clean, cover, and protect it safely between visits.